Okay, here's something that might make you do a double take. Certain dog breeds we all love, like English Cocker Spaniels, they seem surprisingly prone to a very specific, kind of unusual cancer.
Yeah, it really shows how unique health issues can pop up in different groups.
Exactly. And what's really interesting, I think, is that while cancer in pets is sadly common, this specific one, adenocarcinoma of the anal sac, it's almost unheard of in cats.
It is remarkably rare in cats. So our mission today for this deep dive is really to get under the skin of this particular condition, pulling out the crucial bits from the text we've got.
Right, we want to understand the key parts, not just list facts. And you might be sitting there thinking, okay, anal sac cancer.
Ah.
How is this relevant to me?
Uh-huh.
Well, even if your pet isn't affected, looking at this specific cancer gives like a fascinating window into just how complex animal health can be.
Definitely.
And we're going to hit some real aha moments, especially when we talk about that weird link to high calcium levels and those specific breeds that are more at risk.
And that link to calcium really highlights how a problem in one spot can cause ripples throughout the whole body, doesn't
It really does. Paying attention to those general signs can be so important.
it? So important. Okay, let's start with the basics then. What is adenocarcinoma of the anal sac?
Right. So fundamentally, it's a malignant tumor. Aggressive. It starts in these tiny glands, the apocrine glands, within the anal sac.
Specialized sweat glands, essentially.
Exactly. And the worry is it tends to invade the tissues right around it. Plus, it has a high chance of metastasizing spreading.
Spreading, yeah. Especially to those sublumbar lymph nodes.
Yeah.
The ones located kind of deep in the lower back area.
Uh-huh. And that brings us to that other really key feature you mentioned.
The hypercalcemia, right? It's one of the most striking things about this cancer, clinically speaking, that abnormally high calcium in the blood.
And it's not because the tumor itself is full of calcium, is it?
No, not at all. It's because the tumor often pumps out this substance,
Uh-huh.
a parathyroid hormone-related peptide, PTHRP for short.
Okay, PTHRP, let's unpack that a little. So it's like a mimic. It tricks the body.
Precisely. It acts like the real parathyroid hormone, telling the body, hey, we need more calcium, even when levels are actually fine or even high already.
Wow. So the body just keeps releasing calcium.
It does. And this isn't just a minor tweak. It can really throw things off balance systemically. Affects organs, everything.
Which probably impacts the overall outlook, I imagine.
Absolutely. It contributes to why the prognosis is often described as, guarded to fair. It just adds another layer of complexity to managing this already aggressive cancer.
Okay, so who usually gets this? You mentioned it's mainly dogs.
Yes, overwhelmingly dogs, and typically older dogs, which unfortunately fits the pattern for many cancers.
And the cat thing is just super rare.
Extremely rare. But here's where it gets really specific with dogs. The breed predisposition.
Right, that's what I found so striking. English Cocker Spaniels are way overrepresented.
Significantly.
Right.
And also Springer Spaniels, Cavalier King Charles Spaniels.
Yeah.
They also show up more often than you'd expect by chance.
That feels like it has to point towards genetics, doesn't it?
It strongly suggests it. There's likely some inherited factor or factors in these breeds that maybe affect how cells grow in those glands, or perhaps how the immune system keeps things in check there.
Imagine if research could pinpoint that, maybe specific screening.
That's the hope down the line, potentially. The text also notes, interestingly, that some studies found it more often in females. The why behind that is still a bit murky, though. Hormones, maybe?
Could be, definitely needs more looking into. So, okay, if you're listening and you do have one of these breeds, or just an older dog, what signs should raise a little flag? What should you look out for?
Well, the signs can be quite varied. Because of where the tumor is, you might see issues directly related to, the rear end.
Like trouble pooping.
Exactly. That straining, which we call tenesmus. Or maybe you or the vet might feel an actual mass back there during an exam.
Okay.
And if it's spread to those nearby lymph nodes, the sublumbar ones, if they get enlarged, they can press on things too, causing more straining, maybe constipation.
Oh, right. Or even making it difficult to urinate. That's called stranguria.
So those are the sort of local physical signs. But what about the systemic stuff from the calcium?
Right. That's the other side of the coin. The hypercalcemia can cause more general whole body signs, things like loss of appetite, anorexia, drinking a lot more water, and urinating a lot more polyuria and polydipsia.
The classic PUPD.
Exactly. And just general lethargy, seeming tired or low energy.
And the tricky part is those signs are pretty vague, right? Lots of things can cause them.
Very true. They're nonspecific. But in the context of, say, an older dog, especially one of the predisposed breeds, or if there are also some rectal signs, then these systemic symptoms become much more significant clues.
Gotcha. And what might a vet find on the physical exam itself?
Well, they might feel a mass associated with one of the anal sacs. Sometimes, and this is important, the main tumor can actually be quite small, even if the disease has already spread quite a bit.
Really? So a small lump doesn't mean it's early stage necessarily? Not necessarily. And the vet might also be able to feel those enlarged sublumbar lymph nodes, either through a rectal exam or by carefully palpating the abdomen.
Okay, so we've got the signs, the breeds. What actually causes this cancer to start? Any known risk factors like diet or environment?
That's a key question. But the information we have is pretty blunt. No definitive causes or risk factors have actually been identified.
Huh, so we just don't know yet.
We don't. Which really underscores why more research into how this develops is so critical.
And that lack of a clear cause, plus the varied signs, I guess that makes diagnosis challenging. What else could look like this?
Absolutely. That's where the differential diagnosis list comes in. The vet has to consider other possibilities that might present similarly.
Like what?
Well, simpler things affecting the anal sacs, like an abscess, which is common, but also other types of tumors in that same general area.
Okay.
Things like perianal adenomas or even other adenocarcinomas, mast cell tumors, lymphoma, squamous cell carcinoma, and sometimes even things like perineal hernias can confuse the picture initially.
Wow, that's quite a list. It really shows you need a proper workup.
Definitely. You can't just guess based on symptoms alone. A thorough investigation is essential.
So what does that investigation usually involve? What tests are run?
Typically, it starts with baseline tests, blood work, a CBC, or complete blood count, and a biochemistry profile, plus a urinalysis.
Standard stuff.
Standard, but crucial. The biochemistry profile is where you might pick up that hypercalcemia, the high calcium. Remember, that shows up in about 25 to 50% of these cases.
That's a pretty significant chunk.
It is. And the blood work might also show signs that the kidneys are being affected, maybe secondary to that high calcium over time.
Okay. Are there more specific blood tests if you suspect this?
Yes. If the calcium is high, but maybe the vet can't easily feel a tumor, they might run tests to measure the actual parathyroid hormone level and, importantly, that PTHrP level we talked about.
Ah, the mimic hormone.
Exactly. If the PTHrP is high, that strongly points towards the cancer being the cause of the high calcium, and anal sac adenocarcinoma is a prime suspect in that situation.
That seems like a really useful marker then. So blood tests give clues. What about looking inside? Imaging, X-rays, ultrasound.
Imaging is absolutely key. It helps determine the stage how far the cancer is spread. Abdominal X-rays or radiographs are good for seeing the general size of those sublumbar lymph nodes and checking the nearby bones like the pelvis and lower spine.
Okay.
Then you'd usually want chest X-rays too because the lungs are a common place for cancers to spread.
Right, check for mets.
Exactly. An abdominal ultrasound is often used for a more detailed look. It's better at spotting mildly enlarged lymph nodes that might not show up well on X-ray, and it lets the vet examine other abdominal organs, like the liver and spleen, for any signs of spread there, too.
So X-rays for bones and bigger nodes, ultrasound for soft tissue detail.
That's a good way to think about it. Ultrasound gives great detail on the internal structure of organs and smaller nodes.
And the text mentioned MRI. Is that used often?
It's becoming more common. MRI, or magnetic resonance imaging, seems to be even more sensitive than ultrasound for detecting lymph node involvement, especially subtle enlargement. It gives a really detailed picture of the local anatomy and potential spread.
Okay, so you've got symptoms, maybe some blood work clues, imaging that shows suspicious areas. How do you get that definite final diagnosis? You need tissue, right?
You do. Ultimately, you need to look at the cells or the tissue structure. A common first step is fine needle aspiration, or FNA, of the anal sac mass itself.
Sticking a small needle in to get some cells?
Yep. Now, sometimes just looking at the cells isn't enough to be 100% sure if it's benign or malignant in that perianal area, but this specific adenocarcinoma often has a certain neuroendocrine look to the cells that can be quite suggestive.
Ah, okay.
And you can also do FNAs of any enlarged lymph nodes or suspicious spots in the liver or spleen to see if the cancer cells have spread there.
So FNA gives strong clues, maybe confirms spread, but for the final word?
For the definitive confirmation, a biopsy is usually needed. Either an incisional biopsy, where they take a small piece of the tumor surgically, or sometimes, if everything points very strongly to this specific cancer based on location in the FNA results, they might go straight to an excisional biopsy, which means removing the entire mass. That serves as both diagnosis and the start of treatment.
Right. Which brings us to treatment. What's the main approach once it's confirmed?
Surgery is really the cornerstone. Removing the primary tumor, and also any enlarged regional lymph nodes if possible, offers the best chance at improving survival time.
So cutting it out is key.
It is.
I
But, and this is a big but, depending on how large and invasive the tumor is when it's found, surgery might be more palliative,
meaning
meaning it's aimed at relieving symptoms, improving quality of life, rather than achieving a complete cure. Sometimes the tumor is just too entangled with vital structures to remove completely.
gotcha. But even reducing the tumor size can help, right? Especially with the calcium issue.
Yes, absolutely. Even just debulking the tumor, removing as much as possible, can help lower that PTHRP production and manage the hypercalcemia, at least for a while.
And what about dealing with really high calcium before surgery?
Good point.
Hmm.
If a dog comes in with severe hypercalcemia, they often need to be stabilized first. This usually involves intravenous fluids, specifically saline solution, what we call saline diuresis, to help flush out the excess calcium and bring the levels down before attempting anesthesia and surgery.
Makes sense. So surgery is primary. What about other options? Radiation?
Radiation therapy definitely has a role. It can be used after surgery, especially if the surgeon couldn't get clean margins, to try and zap any remaining microscopic cancer cells and delay the tumor from growing back locally.
Okay.
It can also be used to target those sublumbar lymph nodes to try and control metastatic disease there.
And medications? Chemotherapy. Does that work well here?
The results with chemotherapy are, well, they're mixed, and reports are somewhat limited. Getting a complete remission with chemo alone is pretty uncommon for this cancer.
So not a magic bullet.
Not usually. But some drugs have shown partial responses in some dogs. Platinum-based drugs, like cisplatin and carboplatin, are sometimes used, though cisplatin has kidney toxicity concerns and isn't used in cats.
Right.
Mitoxantrone is another chemo drug that's been used, sometimes alongside radiation. There's also some suggestion that a drug called melphalan might be helpful after surgery.
Okay.
And more recently, there's been interest in targeted therapies. Tosyrenib phosphate, which targets specific pathways in cancer cells, has shown some benefit, like partial responses or stable disease in some dogs where the tumor could be measured.
So it sounds like often it's not just one thing, but maybe a combination approach. Surgery plus radiation, maybe chemo.
That's often the case.
Yeah.
A multimodal approach, tailoring the plan to the individual dog's situation, the stage of the cancer, their overall health, tends to be the most comprehensive strategy.
Okay, so let's say treatment has started. What kind of follow-up are we looking at? How is the dog monitored?
It really depends on how successful the initial surgery was. If they believe they got a complete resection, complete removal,
Uh-huh.
the monitoring usually involves regular checkups, physical exams, chest x-rays to watch for lung mets, abdominal ultrasounds looking for any local recurrence or spread to other organs, and blood tests, especially checking calcium and kidney function.
How often?
Typically, maybe every 1-3 months initially, then stretching out to every 6 months or so if everything looks clear.
And if the surgery wasn't complete, if some tumor was left behind?
Then the monitoring is more focused on, well, tracking the size of that remaining tumor, watching for progression, and keeping a very close eye on those calcium levels and kidney values, because problems there are more likely.
Right. So the big question then, what's the long-term outlook? The prognosis.
As we touched on, it's generally considered guarded.
Mm-hmm.
That's mainly because of the risk of the tumor growing back where it started and its tendency to spread.
But cures are possible.
They are, yes. Particularly if it's caught very early and treated aggressively, usually with successful surgery. And even if not cured, the tumor growth rate can sometimes be quite slow. Plus, removing metastatic lymph nodes, if feasible, can really make a difference in survival time.
That's interesting. Removing the spread can still help significantly.
It can. The text actually mentions specific survival data from studies.
Yeah. What did those show?
Well, older studies looking at many dogs reported median survival times anywhere from, say, 6 months up to maybe 20 months. It varied a lot depending on the stage at diagnosis and the treatments used.
Okay, so a wide range.
A wide range. But interestingly, a more recent study mentioned looked specifically at dogs without metastasis at diagnosis. And for that group, the median survival time hadn't even been reached after nearly 3 years, 33 months of follow-up.
Wow, that's much more optimistic for early-stage cases.
It suggests that if you catch it before it spreads, the outlook can be considerably better. And reinforcing the point about lymph nodes, dogs with node metastasis lived longer if those nodes were surgically removed compared to those where they weren't.
Okay, that's really important info.
Definitely. But ultimately, the text concludes that for dogs where the tumor can't be completely removed, they often eventually succumb either to the complications of the hypercalcemia, like kidney failure, or just the physical impact of the tumor growing locally or spreading further.
Okay, so let's try and boil this down. The key takeaways for you, the listener, from our deep dive today.
I'd say remember, this is an aggressive cancer from the anal sac glands. Certain breeds, English Cockers, Springers, Cavaliers, are definitely predisposed. Watch for that unusual link to high calcium, the PTHRP connection. And know that diagnosis involves ruling out other things, using imaging, and usually getting a tissue sample.
Right, and treatment.
Treatment hinges on surgery, often combined with radiation or maybe specific chemo or targeted drugs. Prognosis is guarded overall, but early detection and aggressive treatment, especially successful surgery, can really improve the outcome.
Okay. And to leave you with something to really, chew on, given those strong breed links we talked about,
Yeah.
what could future genetic research into why these specific breeds are so susceptible actually tell us? Could digging into their DNA unlock secrets about how this cancer develops?
That's a fascinating thought.
And could that, maybe years down the road, lead to totally new ways to screen for it earlier in those breeds or even preventative measures?
It really highlights the intersection of genetics, cancer biology, and veterinary medicine, doesn't it? Lots still to discover.